And yet another Survlogmore. As the conference season kind of kicks up, you get to see a little bit more of these. This is an opinion survey, pharmacy technician roles in the Pharmacy Practice Model Initiative, or PPMI, from the American Society of Health System Pharmacists. The Pharmacy Practice Model Initiative is a whole deal being put together by ASHP. Basically, what they're trying to find out is, where do we want pharmacy to be 20 years from now? I think they wanted to get everything by like 20. There's a bunch of different competing initiatives. But basically, they're trying to set what they want the future of pharmacy practice to look like. And that might be, I think there was something else that was supposed to be done by 2020, which didn't seem like it was going to. Oh, residency training for all pharmacists, all new pharmacists. They wanted that, I think, by 2020. I don't think they're going to make it unless there's a huge expansion in residencies right quick. This is separate. This is the future of pharmacy practice. They're trying to put together what is the pharmacist's role, what are the kinds of things they should be doing, how is this all going to get done, stuff like that. So, question number 1. Are you aware of the recommendations of the PPMI related to pharmacy techs? Not. I'm aware that there are recommendations, and I'm aware of some of them, but I'm not intimately familiar. No. To what degree do you agree with the PPMI recommendations regarding pharmacy technicians? Pharmacy technicians who have appropriate education, training, and credentials could be used much more extensively to free pharmacists from drug distribution activities. I agree with that. What this is getting at is, for most of history, pharmacists have been in a dispensing role. And even just think about more modern history. The pharmacist has been in charge of the store where you pick up your drugs, and he has made a living on selling the medications. The thing is, all kinds of forces are conspiring to cut down the cost of medications, and the reimbursement thereof, to the point now where there are certain medications in certain pharmacies and what have you, where you actually lose money by filling a prescription. You are paying X amount of money to buy the medication from a wholesaler or whatever, so it costs you X to get that drug into the pharmacy. And when you sell it to a patient and you charge their insurance, the insurance agrees to pay you Y amount. And sometimes Y is less than X. You might be paying more to buy the drug than you are getting for selling the drug. And that kind of sucks, because that means you're not making money doing the kind of thing that, that's what pharmacies were there for. So now the move is more towards getting pharmacists out of that dispensing, or what's called the drug distribution activity, and more towards putting their cognitive services, which means, their thinking, their brains, putting that to work. When you go, I was about to say, when you go to the doctor's office, you're not paying the doctor to stick a stethoscope on your chest. You're paying the doctor for his expertise in recognizing what the different sounds he's going to hear through that stethoscope mean and how to treat them. You're not paying him to hit you on the knee with the little rubber bumper. You're paying him to know what it means based on how your knee moves after he hits it. Stuff like that. And that's the same thing with the pharmacy. They want to move away from you paying the pharmacist for an actual drug product and instead paying a pharmacist for his expertise in drugs. And that's what's called cognitive services. Somebody has to be there to do the drug distribution. Someone has to put the bottles on the shelf, take the bottles off the shelf, count out the pills, put it in a bottle, slap a label on it, all that stuff. Someone still needs to do that because it needs to be done, but it doesn't require the expertise of a pharmacist to do most of that. So they're saying put most of those activities, insofar as they're capable, on the technicians. And I agree with that. Assigning medication distribution tests to pharmacy technicians would make it possible to redeploy pharmacists' time to drug therapy management activities. I agree. This is particularly evident to me at a community pharmacy, where the pharmacist, for the most part, is kind of stuck at his computer because he has to, On the one hand, you have prescriptions going in where he has to review the information on the prescription, make sure it was typed in correctly, make sure that it's appropriate. Some of that is requires a pharmacist, especially for the appropriateness of the medication and drug interactions and allergies and all that. You need the pharmacist's brain there. But when the medication comes the other way, it's already filled, it's in the bottle, it's got a label. What the pharmacist does is he opens up the bottle, looks at the pills, makes sure that they're the right pills, puts the lid back on, and sticks it in a bag. You don't need a pharmacist for that. And so getting a technician to kind of take care of the, matching what's in the bottle to what's on the screen, what should be there. If you have a technician doing that, now the pharmacist is more free to talk to the patients, to counsel on medications, to go outside and help people pick out over-the-counter medications for whatever, that kind of stuff. I'm in favor of that. ASHP should define a scope of practice, including core competencies for hospital and health system pharmacy technicians. I agree with that. If you're going to allow technicians to take a greater role and responsibility in drug distribution, there should be a set of this is what you should know before we let you do that. Just like for pharmacists, you go to pharmacy school, you take the NAPLEX, you take a law exam. These say, yes, I know this much. You can trust me, up to here. And there's already something similar to that and we're actually apparently going to get to it down here. Pharmacy technicians already can become certified. They take a test and prove that they know this much about medications. There is some, do you know about medications, like what class very common medications belong to? Are you able to do the math? Do you know some of the federal or state pharmacy law involved in this? That all comes together to become certified. I am no longer, but I was a certified pharmacy technician. My certification lapsed because I went to pharmacy school. I didn't feel like I needed to pay a fee and re-up that certification since I would be on an intern license and not a technician's license. But I like that. So we're going to work our way there. Uniform national standards should apply to the education and training of pharmacy technicians. I think that there should be some sort of universal standard, personally. Right now, technicians run a gamut. In Arizona, technicians are licensed. You have to go to the State Board of Pharmacy and you have to get a license to work as a pharmacy technician. And you're provided with a technician trainee license, and you are given a certain amount of time. I think it's 2 years, but I'm not sure, in order to become certified. And if you do not become certified by the expiration of your trainee license, I think that you can't be licensed anymore. Or you might have to go to the board and ask for an extension or whatever. But yeah, in Arizona, they are licensed, and everybody's tracked. And that becomes important kind of from a law perspective, in that if you have a technician who is stealing medication, and then they get fired, and then they go to another store, if they don't have a license at a central body from which to track, then you might never know that they were, caught stealing medication before. Other states, for example, I think Pennsylvania, I'm not entirely sure, but I think in Pennsylvania, they do not license technicians. If not Pennsylvania, I know there are states where they do not license technicians. It's completely up to the pharmacist. There might be some rules from the state boards of pharmacy in those states that kind of define what a technician is, but they don't license them. But then basically everything goes on the pharmacist, and the technician is not personally responsible for anything they do. Now that's all just licensing. But here it's education and training. There should be some uniform national standards. Pharmacists have a uniform national standard up for training, kind of. We were actually discussing this today on my rotation that I think it was California and Florida are different, or if they aren't different anymore, they were different recently, where such that there were issues transferring a license that you got in one of those states to another state. So there's some things that are not particularly standardized there, but I do think I'm in between neither and agree. I do think there should be some national standards. it would especially help with all those poor souls that go to the pharmacy technician vocational schools, which charge huge amounts of money. It's criminal almost how much money they spend in order to get a technician's job. Now, maybe coming out of those programs, they're better trained and able to get a job like in a hospital. You get paid more as a pharmacy technician in a hospital because you basically take over certain tasks that are much more what's the word I want? Complex, I guess. Like if you were in the hospital and you were the technician that helps make IVs, we want you to be trained well, and we are willing to pay you more money to take for that responsibility. Okay, to support optimal pharmacy practice models, technicians must be certified. Yes, I think technicians should be certified. I don't think they need to be certified immediately, and kind of that isn't there. I think you should be able to work as a technician, for a certain period of time before you have to become certified. And I think that period of time needs to be kind of long enough for like on-the-job training, but at the same time short enough that you're not that you skip out on it, kind of. Especially if there's no licensing in the state. So if you get hired on for this job, and let's say you have 2 years before you need to become certified. Well, after a year and a half, you quit, and then you go get another job as a technician somewhere, and now you get another 2 years as far as they know. I don't like that idea. By 2015, the Pharmacy Technician Certification Board should require completion of an accredited training program before an individual may take the certification exam. Oh, I want to agree to this, but I don't. I want to. Let's just say the easier one. I don't want to agree to this because I don't want programs like those trade schools where they charge you $10,000 to become a pharmacy technician to have some sort to kind of get an added legitimacy from the you need to complete an accredited training program thing. On the other hand, I do want them to have an accredited training program because these schools would then actually be providing a service. I'm kind of harsh on them. I can't say that every school you ever go to that might do pharmacy technician training is just like a scam. I don't think they're literally trying to scam you. I think they think that they're doing something good enough. But at the same time, like the pharmacy I got my job at trained me to be a technician and then trained me to get certified, all without me spending a dime. In fact, they were paying me while I was doing it. So I think those programs are kind of a rip-off. But having it... and that's why I don't want there to be this accredited program. Because if people start then thinking, oh, I need an accredited program in order to become a technician, and this is the, if people think those $10,000 9-month programs are the only ways to get it, that's upsetting. I don't want people to have to spend so much money and so much time to become a technician. I do think they need training and all that, but I don't think they need to necessarily go to school for about a year and spend all that money to become a technician. But I do think there should be a certified training program, and I do think I'd also like it if you could get the program, an accredited program, like at pharmacies, like a chain pharmacy, for example. They should be able to meet some standards and get a program accredited so that they can get their own, employees certified without having to go to an outside facility. Independent pharmacies and all them, they should be able to, abide by certain standards and get it done. The only problem with that is when you end up with these, as long as everybody meets certain standards thing, if you water the standards down too much, it doesn't really help as much. So there's a bit of a balance between making the standards stringent enough to be useful, but lax enough that they can be implemented in a variety of institutions. So I want to say neither. I really want there to be an accredited training program. The biggest thing with me, I love standardization. I want to be able to know what I am getting here is what I would be getting there. And this mostly comes up because of pharmacy school. I went to a 3-year school, which is not the normal, educational milieu for pharmacists. So I constantly wonder, how does my 3-year program compare to a normal traditional 4-year program? And I'm never really going to know unless I go back and go to a 4-year program and find out. Or maybe if I work at a 4-year program and actually see it for a couple years as the students go through. But that kind of, that is always there for me. What am I, how do I compare? What am I missing? Did I get any, extras, or did I miss out on something? I don't know about that. And that's why I like the fact that if you have this accredited training program, there are these set standards, and you know that if you went to this school, or you went to this pharmacy, or you went to this hospital, you're going to get the same training at each one of them. That would be awesome. To support optimal pharmacy practice models, I love how I just switched gears like that. Technicians must be licensed. Strongly agree. Technicians should be licensed. I can't even, because I came into pharmacy as a licensed technician, I can't even grasp the idea of not being licensed as a technician. For all the stuff that I did as a technician, to not be personally responsible for any of that, that would have been, it blows my mind to think of that. But knowing that I had a license, I had a responsibility to my license, both to do the job correctly, but then also to become certified, and I had to do some of this work and study and all that. I think that really reinforces the position and the gravity of the work that I'm doing. And the certification also does that. It says, you get on the job training, you learn how to type in prescriptions and all that. My pharmacy taught all of that to me, but it's more than that. I also need to take this test and prove that I know stuff, things like that. I like that. I think that that's good, but I definitely think pharmacy technicians should be licensed. Most distributed functions that do not require clinical judgment should be assigned to technicians. I agree with that. We already talked about that. They have what's called Tech Check Tech. A technician fills a prescription, and another technician checks and makes sure it was filled correctly. Now, this only concerns making sure that it's the right pill in the bottle, it's the right number, stuff like that. I don't think it... I can see where they might allow technicians to double check and see if a prescription was typed correctly, but you could never get the pharmacist's clinical check out of that process. So I can see where they would just keep the pharmacist doing the typing check because they're checking the all that other stuff at the same time. Opportunities for technician specialization should be developed. I do think there should be some options for technician specialization when it comes to, for example, IV preparation technicians, inventory technicians. One of the things you can learn, go into pretty much any pharmacy, and there's a technician who's in charge of, who basically is in charge of inventory and ordering new medications from the wholesaler and all that. That's a technician function. And like my store, my technician took care of that. So my senior tech, she took care of that. You couldn't even ask the pharmacy manager. It's just, go talk to her. She's in charge of that. And actually today at my rotation, the pharmacy manager kept coming out and asking the technician, do we need to order this? Which of these are we supposed to have? Blah, blah, blah. And I'm like, well, that's just the way of things. I do agree that there should be some specialization. You notice that I'm mostly on the right side of this. And by right, I mean correct. No, I mean the right side. Which of the following activities do pharmacy technicians perform at your institution? Initiation of medication reconciliation, including obtaining and documenting patients' medical... Yes. Now, I'm going to answer this as my community pharmacy. And so here, initiation of medication reconciliation, including obtaining and documenting patients' medication information for pharmacist review. You come up to my pharmacy and you drop off a new prescription and you haven't filled here before, I'm going to ask you what other medications you're on, and then I'm going to put those into the system so that when the pharmacist reviews your prescription, he will have a list of medications to look at and see if there's interactions or any other concerns. So yes, I do that. Reviewing patient charts to identify medication allergies that require pharmacist follow-up. Kind of. I did that as a technician. If a patient came in with a prescription, their allergies show up on the computer screen, and if I saw that they were allergic to something, as a technician, I always went right to the pharmacist and said, it looks like they're allergic to this. And now as an intern, I just straight up asked the patient, straight up. I remember my very first rotation, I kept saying straight up to my preceptor, and he just thought it was the funniest thing. I'm like, I looked at the chart, straight up. He's like, what do you mean straight up? I mean, straight up. You mean you're not upside down? I'm like, no, straight up. I just straight up looked at the chart. That's how I found that out. Oh, that's funny. Oh, here's that tech thing I was talking about. Anyway, now I asked the patient, it says here you're allergic to blank. Are you, and then they'll say something, but usually yes or no. And then I'll ask what kind of reaction they had, and then I can evaluate whether or not it was an allergic reaction or just an adverse drug reaction. Even if it's an adverse drug reaction, I leave it in the system. That way the pharmacist can talk to them. When I am a full pharmacist, I would just tell the patient that's just a side effect. I'm going to take that off of your profile. Blah, 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 blah. I'd talk to them about it. Depends on what kind of reaction it was. Checking dispensed by other technician. Tech. We do not do tech. We already talked about that. Compounding routine sterile preparations in conformance with well-documented procedures. Okay. Where I am, we don't do steriles, so no. But that's definitely something that's done often. When I was on my second rotation, they had a technician who basically spent his entire day just doing that. Dispensing medications with remote video supervision by pharmacists? No. I have seen this described a couple times. There are sites where they don't want to pay a pharmacist to be there all day, and a pharmacist probably doesn't want to be there all day. So what they do is they have the pharmacist monitoring like multiple locations, and then they have a technician at the locations, and there's a video screen and a camera, so the pharmacist can see what's going on, and the technician can hold the medication up to the camera, and the pharmacist can check it that way and stuff like that. Scheduling patient outpatient clinic drug therapy management visits. Actually, kind of yes. We do medication therapy management, and a technician is in charge of doing that scheduling. The technician calls the patient, says that your insurance has, asked the pharmacist to go over your medications with you, and blah, 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 and actually sets up an appointment if the patient is willing. Criteria-based screening of medical records to identify patients who may require pharmacist intervention. No, we don't do that. I can see where they would have a technician do something like this. They would just have a list of things that they would look for. And it would spell out all the different things that they're supposed to find. And basically, it's just, it's robotic work is what it is. Here's the list of things. Look at the record. Does anything match up? If yes, put it in this pile. If no, put it in that pile. So again, something that you wouldn't necessarily need a pharmacist to do. The technician can sift through the giant pile of work like I did today. Today at my rotation, I was given 400 prescriptions, and I was going to do a mock board of pharmacy review. The pharmacy manager told me, this is what they're looking for. You need to have this. Make sure all of these elements are on the prescription. And then he's like, here you go. And so I had to go through all 400 prescriptions and find everywhere where there was a date that was incorrect or a missing check mark or what have you. And there were 31 out of 400 prescriptions, 31 little dings, as it were. But that's kind of robotic work. It helped me a lot. There were lessons to be learned there. Don't get me wrong about that. Especially as it came to matching up the brand name on the prescription with the generic name that we have on our prescription labels. But what was I going for here? Oh, but the actual work was robotic, and it wouldn't need like a pharmacist to do that. That's something like a technician could easily do. Preparing clinical monitoring information, for example, INRs for pharmacist review. No, techs don't do that, but again, that's just taking information. The lab sends back the lab results. It's easy for the technician to pull up the list of people coming in for anti-coag clinic and write the INRs next to their names. It's something that they could do. Inspecting and replenishing medication storage devices. Yes, we do. My pharmacy here in Arizona has what are known as Baker cells. And it's an automated counting system. And there's a bunch of different little boxes that each have a different medication in them. And the computer says, count out 30 hydrochlorothiazides. So you go and hydrochlorothiazides in bin 25. So box 25 will count out 30 pills, and then they'll fall down into a little collection chamber, and you'll go and put the bottle underneath and get the pills out. Technicians are in charge of making sure that it stays stocked, although the pharmacist double checks the medication before you put it into the machine. And technicians, for example, me, when I was a technician, are in charge of pulling everything apart and finding out what went wrong when it breaks. Because every once in a while you'd have it and it would count the pills wrong, or it would get stuck or jammed, and that was a technician job. Managing controlled substances systems. We don't do that, no. Managing medication assistance programs. We also don't do that. Medication controlled substance systems, I'm guessing, would be like an automated dispensing controlled cabinet. I'm not sure. Medication assistance program sounds like some sort of like insurance or discount card thing. Conducting aspects of quality improvement programs, yes. Quality improvement covers a whole bunch of different things, but we actually had like a meeting, I remember, as a technician, where we all got together and mentioned the different problems we saw in the pharmacy and how to improve it. One of the things that I had done, and again, everything's about me, those same Baker cells, each of them was numbered, and when you got a prescription, it told you the number of the box to go to. Now, most of the time, it was really easy to match the boxes up. You didn't often have people grabbing medication from the wrong box because it told you the number. The issue would be you would have two prescriptions for the same medication print at the same time, and the box can only dispense one at a time. So let's just say that hydrochlorothiazide, you had one prescription print for 30 and another one print for 90. Well, there's 30 pills in the counter because the 31 printed first, but you might grab the label for the 90 count and go grab the 30 pills instead of 90 pills. So now this patient is going to get less medication than they should. So I had mentioned always, when you go to pick it out, always tell yourself the number of the box and the number of pills, so you make sure you're getting the right one. Because we had it happen a couple times in a row where people were getting the number of pills mixed up because two labels printed at once. Managing pharmacy department information technology systems, including routine database management and billing systems. I'm going to say yes. There's a bunch of stuff that could have gone on here, but we definitely, as technicians, okay, supervising, no, yes, and no. We definitely deal with the computer quite a bit, and we definitely, like I had mentioned earlier, are in charge of ordering at my pharmacy. We're not business managers though, and we don't technically supervise other technicians. We're training. We were a training store, so we trained other technicians, and in a way, we kind of supervised them. But even the senior technician was not technically in charge of us, although she did get to make our schedules. Excuse me. Clear my throat. What level of knowledge and skill does your organization require when hiring? High school diploma, licensure through the Board of Pharmacy. We only require high school diploma because you need one in Arizona to get a license through the Board of Pharmacy. So that's it. That's what we require for a pharmacy technician. You must have a diploma and a license. Now then we require, after you get hired, you are required to become certified and PTCB certification. But that's also a requirement of licensure in Arizona. So I don't know if that was my store or if that was just because you were required by the Board of Pharmacy. I am a pharmacist compared to technician. I'm much closer to this one. Please select one that best describes your position. I am staff. That's what I am. And complete the following information. You guys don't get to see that, but I am from Mesa, Arizona. You don't get to see my company because you don't get to see my company. That's why. So until next time, bye-bye.